Now that we supposedly know information about fundamentals of skin, Fitzpatrick skin type, and laser safety, before we move forward looking at the patient, first check around the safety considerations of your room. First of all, you have to know the wavelength that you are treating the patient with. The goggles that you have in your hand should be appropriate for this wavelength. It means the wavelengths that you are doing the treatment should be covered either on the glasses of your, usually the numbers are written over the glasses. Sometimes like what I'm holding in my hand, it's written in the sides of the glass. Regardless of the brand of the glasses, the wavelength should be included in the range that you are protected with. You will, of course, hold your glasses, be ready, give the patient the darkest optical density glasses. You wear something that you will actually see what you are doing for the patient. What else in terms of safety we have to consider? Here is actually our nominal hazard zone. What is the consideration in nominal hazard zone? Glasses on. So you will pick your glasses in LTCA, wear it when you are in nominal hazard zone. Now that we have a window in nominal hazard zone, the window should be covered because we are using a hair removal. You know that hair removal lasers are the most dangerous. Now that you come to the patient, what is your first responsibility determining what is the patient's
Skin type.
Skin type. So, give me skin type. What do you think is her skin type?
3.
We can never be sure whether the patient is 3 or 4 unless we ask the question. Ms. Raquel, what happens to you when you go to the sun? If you're exposed to the sun, do you get red initially?
Yes.
People who say red, they are 3. If her answer was no, I tan easily, then she would be 4. Exactly. Now that we are going to use a laser, which one of the latest technology that works in motion, I have to have a grid size. A grid size should be more or less precise. A grid size of this machine is 300 square centimeter. Means I have to know exactly where is the grid that I'm working. With which kind of pencil can I do the marking?
White.
Always white pencil. So the markings of the white pencil, I will put a line in the midline. More or less, I know that majority of ladies, they are not much taller than 30 centimeter unless they're really tall. I want like approximately 10 centimeters, 30 centimeters, which gives me the result of 300 square. So this one will be my first grid. Ms. Raquel, can you come a little bit more forward to me? Very good. For this device, we need a gel because now we are going to do an in-motion laser. So we will apply the gel. Your gel doesn't need to be a refrigerated gel. Already with gels in these kind of environments with AC, it's a bit cold, sorry. According to the rules of the HCC, we have to have gloves on when we are touching the patient. I will start for 10 seconds, just showing you how you have to do. Then you one by one will come and continue the treatment.
What kind of cooling we have in this device?
This one is a contact cooling, a sapphire contact cooling, very effective cooling. What is your consideration when you have a contact cooling? As a safety part, how will I pick my laser? Never ever towards anybody's face or even towards the window. Whenever I pick a laser handpiece, I hold it towards the floor. I want you to touch the handpiece.
Oh,
It's very cold.
Yeah.
So this tells you your condition with contact cooling is always full contact. Plus, this laser works on motion. It means since the laser acts faster than our brain can assess, I have to start motion before I start my laser. The last thing you do when you want to do the laser is putting your laser on ready. You have to prepare all the environment, gel, patient's position, your back. Once everything is fine and you are comfortable, then you put your laser on ready. So Are you ready, Miss Raquel? You might feel slight heat only. If you felt the heat you are feeling is more than usual, just let me know. Any sensation you have, let me know. So I'm going to be in motion. I can press only some of the lasers, they have 2 triggers. Now I have 2 triggers for the laser to be shooting. So you can press your foot pedal, but not the finger. I want you to be comfortable with the movement. If I have this much grid, I will place my handpiece in full contact, slight pressure. I start moving. If the area you feel it's too long, you can divide it into 2 squares, and I want to cover everywhere. If you feel the handpiece is heavy, hold the weight of the handpiece with the other hand. Are you ready? How is your sensation? Are you okay? Yes. So, do you see what I'm doing? I'm covering everywhere like a brush, not repeating any line so much, and continuing the motion. Once I have a curve in the body, it's my job to turn my hand to be able to be always perpendicular to wherever I'm doing the treatment. I leave my finger, continue motion, and then I detach my contact cooling laser. So, are you ready?
Yeah, sure.
Start one by one. When I want to handle the laser to somebody else, stand by. Again, once you are ready, everything is ready. Hold the weight with your other hand so it will not pull you.
Yeah.
Everything is fine. Remove this one. So, then you can now yourself put the laser on ready. Laser is ready.
Yeah. So first I go with the motion and then start?
Yeah, exactly. Bravo. Full contact. Very good.
Are you okay, ma'am? Yes.
Anytime in the middle of the treatment, patient expressed any discomfort, any body language, stop the laser right there. Check if the patient is fine, any sensation is there, and then you can continue.
Okay, it is not too much for you?
Yeah, take a look at him.
I'll hand it over.
No, you can continue this grid. Exactly. Exactly. Very good. Are you comfortable? Done already, and then start. Very good.